China's Joint Prevention and Control Mechanism of the State Council held a press conference earlier today, outlining further measures to protect high-risk population groups from COVID-19. At the press conference, officials disclosed that from December 8th last year to January 12th, China's COVID-related deaths in hospitals totaled over 59,000. And as of January 12th, the ratio of people testing positive at fever clinics was down to 10.8%. And for the very latest on this, we can now go live to our reporter, Yang Chengxi. Chengxi, good to see you there. So you were at the press conference. Tell us, what were the key points?
Hi, Chu Yuan. Health officials say from December the 8th last year to January the 12th this year, as you said, there have been 59,938 COVID-related deaths across Chinese hospitals. Among them, some 5,500 cases were deaths directly linked to breathing failures as a result of COVID. Other patients had underlying conditions like cardiovascular disease or cancer. The average age of the deceased is 80 years old. Officials also said that the number of patients visiting fever clinics across the country has continuously dropped from close to 3 million people in mid-December last year to 477,000 on January the 12th. Officials say the data is hinting that the current COVID surge is passing its peak. Now, having said that, senior citizens are among the most vulnerable and make up the majority of hospitalized patients with severe symptoms. Officials say there were about 100,000 of these hospitalized patients by January the 12th, down from a peak of 128,000 from a week earlier. Now, officials also added that the current number of beds across Chinese hospitals are sufficient in meeting treatment requirements. Now, during the press conference, I asked a question that many have been wondering. Looking at the current numbers, it is perhaps important to know the exact criteria that Chinese doctors categorize COVID deaths and whether they are different from that of other countries. Now, according to Jiao Yahui of the National Health Commission, she said the criteria is largely in line with that of the WHO and other major developed countries. Now, officials say the next stage of the fight against COVID is moving to China's vast rural areas, the task of which has become more important as the country is entering its Chinese New Year travel season. Officials say medical authorities have taken precautions by increasing the number of staff at rural institutions and expanding the inventory of medicine and oxygen. Back to you.
All right. Thank you very much for the very latest. Yang Chengxi joining me live from Beijing.